Hi, my name is Pat Chabaro, and I have worked as the pediatric nurse practitioner at the MyFace Center for Craniofacial Care at NYU Langone Health for 34 years. We see a large number of babies born with cleft lip and palate through our cleft and craniofacial programs. MyFace is a nonprofit organization that serves patients and families in the craniofacial community across the country. MyFace has been partnering with another nonprofit organization, Welcome Baby, to provide newborn craniofacial care kits to cleft and craniofacial teams across the country. These kits are given to cleft and craniofacial teams free of charge. The teams then give these kits to families in need. My team has been receiving these kits from Welcome Baby for several years. We are really grateful that over the past year, MyFace has partnered with Welcome Baby and has created a craniofacial care kit that is specific to the needs of babies with cleft lip and palate. Now I just want to point out to you the items that are in this wonderful craniofacial care kit. The first thing that I think is really important to point out is that the kit contains all of the items, or many of the items, that a baby would need in the first month of life. And why I think that's so important is because we really want to emphasize to the families and remind them that not only do they have a baby who has a cleft, they have a baby. And we want to celebrate that. And just to have diapers and wipes and little socks and baby care, cream, etc. What makes it really, really special for our babies is the fact that there are some items that are specifically helpful for our newborns who are born with a cleft lip and palate, specifically if the palate is involved. So I wanted to show you a few of them. The first thing, which I think is the most important, is the Dr. Brown bottle. And the Dr. Brown bottle is a bottle that is specifically designed for babies with cleft palate. And the reason for that is because it contains a valve that gets placed into the nipple. And as a result of placing this valve in this nipple, the baby then does not have to have the ability to create suction to get the fluid, to get the formula or the breast milk out of the bottle. And it just makes the feeding so much more efficient for them, helps them with weight gain, and really helps decrease the stress that a family has when they're worried that their baby won't be able to feed. So this is very, very important. A couple of items that are really helpful for babies with cleft palate, especially because of the feeding challenges that they often have issues with nasal regurgitation or with reflux. And so we have the baby boppy pillow, which really is helpful in keeping the baby upright for about 30 minutes after a feeding. Another item that is super helpful is the baby sling wrap. And what is really helpful with this, again, is that for babies that tend to have a lot of nasal regurgitation or reflux, mom or dad can strap the baby onto this and keep them upright for 30 minutes, and it will help with the reflux and the nasal regurgitation. It's also great for bonding. Another wonderful item is the Swaddle. And what's great about this for babies with cleft lip and palate is there are actually two things. The first is that for babies that are undergoing any kind of pre-surgical molding therapy, having the Swaddle on really helps them at night to not pull at that plate and pull it out of their mouth. It will really help alleviate some of the stress on them and on the parents. So it's really wonderful. The other reason why this is a great item to have in the care kit is that after the surgery, having the Swaddle on then eliminates the concern of parents at night that their baby might be scratching at the suture line. And then the baby does not have to wear any type of elbow restraint if that's something that their team does recommend. So the Swaddle is a great item for a couple of reasons. A wonderful item in this kit is the book that is called Smile with Simon. And this book is written by Patricia Simon, who is a nurse and also an individual who was affected with a cleft lip and palate. And this book is wonderful in teaching the lesson to not just children, but to everyone, that we may look different on the outside, but we are all the same on the inside, and we need to really treat each other with kindness. We've handed out dozens of the newborn craniofacial care kits, and I have so many wonderful anecdotes that will always stay in my memory. And I can think of one family who did not know prenatally that their baby was going to be born with a cleft. And when they came to us about a week after the baby's birth, they were appropriately totally overwhelmed and really had no idea of what items would be important for them to have to help care for their baby, especially in that first month of life. And so when we brought this kit to them and opened it up and showed them the Dr. Brown bottle or the Swaddle, the things that could really help their baby in terms of feeding, which is such a stressful experience for babies who don't have the proper equipment, they were just overwhelmed with gratitude, and they just felt so relieved. And I remember the mom saying to me, I just feel like a big burden was lifted off of my chest because of what this kit is going to do for my baby. These kits truly help to make the first month of the life of a baby with a cleft lip and palate easier for a family in need, and are made possible by the generous support of donors like you. The Newborn Craniofacial Care Kit truly makes life easier for a family in need. Your gift today will make a difference. Thank you so much for your support.